To our daily show with CJ Naselli on RiverBender.com.
Let's give a boy a hand. Let's hear it for my baby. You know you gotta understand.
Oh boy, here we go. 9:19, a little bit of change on this Friday morning in downtown Alton. It's our daily show. Nathan Bishop, EMS coordinator, training center coordinator for JCH Healthcare. How's everything going for you today?
Doing well, doing fantastic. I'm thrilled to be here. Thank you.
Man, I just want to throw this out there. I don't know if you guys just noticed that. You probably have the best radio voice out of any guest I've ever had.
Well, I appreciate that. Thank you very much.
That was awesome. Well, you guys are probably wondering, what did CJ break now? The answer is nothing.
Thank goodness.
No kidding. I'm just here to tell you guys about a really great lecture that's coming up here on the 20th of July here with Bob Page, and this is going to be really fascinating. This is from 8 a.m. to 4 p.m. And Nathan, take us through this if you could. Give us an overview just to start us off on the lecture and the overview of the event.
Absolutely. Bob Page is a phenomenal educator and lecturer. Has been doing this for 4 decades around the world. Wow. Seriously, he's internationally renowned. He does. He takes 2 of the what we might call the most boring subjects or tedious subjects in healthcare and makes them fun and makes them entertaining and makes them educational. EKGs are the study of the tracing of the heart for electrical activity, and capnography is a study of the gas exchange in the lungs. Very boring subjects. I've been a medic for a long time. This is my 24th year in EMS. Very boring subjects. This guy takes it and turns it magical. I mean, seriously, he takes all day. It's an 8-hour class on Thursday, and it's a 6-hour class on Friday, I believe.
Wow.
And just, you can walk in knowing nothing and walk out being amazed. And he makes it fun. He makes it entertaining.
Talk about a hell of an opportunity, though.
It is.
I mean,
he's fantastic.
Wow.
Absolutely fantastic.
So take me through this a little bit. Whenever we're talking EKGs, because I'm not a Googler. I always find out now that I've done this show for I've done a show for 6 years. I've been a part of radio for 6 years. That everyone's a Googler. So when you ask a question, it's like, man, that sounded really good. I know nothing about EKGs or anything like that. So when I hear EKG, that's normally if you're in some distress, right? You get an EKG.
It can be preventative, it can be diagnostic, and it can be acute. What it does, we put patches all over the chest, and it takes a tracing of the electrical activity of the heart. So if there is something wrong, it can pinpoint to where it is, and there can be a myriad of things wrong with your heart at any given time. The EKG allows us to pinpoint where the problem is and tell us what to do about it.
Wow.
Basically. And there is it's very in depth. It's very, very in depth, and it's long and it's tedious and it's drawn out. But seriously, Bob does he makes it fun and entertaining, and it's an important diagnostic tool for paramedics, nurses, doctors.
Well, to me, I mean, we were talking a little bit earlier. I have Food for Thought coming on at 10:35, which is all about food safety, which someone would go, now come on, man, how can you make food safety fun? But when you have somebody that knows what they're doing, that is experienced in this and is a great orator, you can learn a lot of great things.
Exactly right. This is seriously, I was saying earlier, this is the kind of guy that brings medics out of the woodwork.
Oh, yeah.
You hear the name Bob Page. Oh yeah, where? I'm there. Seriously.
How long did it take you to set this up?
We started communicating in February.
Wow.
Yeah, he's all over the country, but he is internationally as well. He's from Virginia, I believe, unless I'm mistaken.
That is just incredible.
Yeah.
So where is this taking place at?
At the Jerseyville High School. Okay. In the cafeteria at the Jersey Community High School on State Street in north end of Jerseyville.
And then for the folks that are wanting to be a part of this, which if I'm a medical professional, I'm wanting to.
Absolutely. And CEUs. Everybody in healthcare needs CEUs. Yeah, 16 CEUs in 2 days.
Oh, you're welcome. You are welcome. So I have a bunch of physical therapists or occupational therapists in the family that every year the CEU.
They're stressing over their CEUs. Yeah, medics have to have 100 CEUs in 4 years.
Oh wow!
So 16 in a 2-day class, especially an entertaining fun class.
Exactly.
Exactly.
Oh, man,
so we're really excited.
When you register, I'm assuming you have to register in advance.
Yes, we have the on our ambulance JCH Ambulance Association is our Facebook page, and it's been shared on numerous Facebook pages. There's a way to register through there, and actually this is being covered by the SAMHSA grant, which is if I try to spell it out, I'll mess it up for you. I promise you I will. But it's a federal grant having to do with substance abuse and education for healthcare providers, and so the class itself is being covered by the SAMHSA grant, which is fantastic.
Wow,
fantastic. And that SAMHSA grant is really helping us grow and expand our education as a whole. Not only this, but our education as a whole. But there is a $20 fee for food. We'll have breakfast and lunch both days.
$20?
$20 and 16 CEUs.
So,
I can't say that enough.
Anybody that knows anything about CEUs and just me listening, $20 to get you 16 hours of CEUs is a pretty damn good deal.
Especially when it's a fun class. Especially when it's fun. The name of his company is actually Edutainment. Education and entertainment combined. Edutainment.
Well, and to me, like you just said earlier, I mean, you're paying $20 just for food and basically getting a free lecture from a world-renowned speaker.
It's fantastic.
Now, you were talking about substance abuse from the SAMHSA grant a little bit, and this is just me throwing it out there, but I'm just curious, how, and just your experience, how does, a substance like, a methamphetamine or a heroin, an opiate, how does that affect reading an EKG?
It has a significant effect on the heart.
Okay.
It has a significant effect on the heart, and the EKG itself tells us, okay, this is what's going on. This is the part of the heart that the problem is in. So then we know which part of the heart to treat, what medication they need, what treatment they need based on what this. I mean, this is the cardiologists use an EKG to diagnose their patient.
That is just
Paramedics,
fascinating.
doctors, cardiologists, everybody, and it's literally an electrical tracing of the heart. But there are so many facets and so many elements to it that it's difficult. I mean, like I say, I've been doing this for nearly a quarter of a century, and there's more for me to learn. Wow. Seriously.
Oh, that's just incredible. And then flipping it on the other topic with the gastro, help me out here.
Capnography. Capnography is it's a tracing of the gas exchange, the way that your lungs are exchanging the carbon monoxide for the oxygen. Mm-hmm. It's showing how effective the intake of oxygen is, how we need to adjust it, if we need to add supplemental medication along with it. It just gives us a good idea of how the gas exchange is working in the lungs.
That's actually really fascinating. And then, like, we're just going back to this. When you hear the name Bob Page, like you said, medical field, I mean, you're going because there's so many different things to learn. And have you, this is your first experience in person with?
My first experience in person. I've seen a couple of these Zoom things through the years, but my first experience in person,
Well, from Zoom, if nobody's ever been a part of one, what was your takeaway from it?
It was good. It was entertaining. It was educational, but I'm so excited for it.
It was a test,
Yeah, exactly.
Man, that is so cool. And yesterday, we'll circle back to the speaking engagement, which we're going to hit a couple of times because 16 CEUs from a world-renowned lecturer for $20.
Exactly.
Get out of here. This is incredible.
We're very excited.
I wanted to ask you about the Ambulance Foundation, too.
Okay.
Because I do a little bit of research, nothing too crazy, but just always type in the name to LinkedIn, and I saw that you co-founded the organization in 2015?
2015.
And take me through, how'd that look?
So the Jersey Community Hospital Foundation is a nonprofit, a 501c3, and they supplement the hospital tremendously. They do a ton of work to benefit the hospital. Some of my colleagues and I got together and said, there are things that we would like to have for the ambulance. They're not necessarily required. Mm-hmm. They're costly. They may not make it through the capital budgeting process, but they are things that would benefit us. So why not raise funds and get them? And, we hit the ground running, and our community and our county are tremendously supportive. I think to date we are approaching the $200,000 mark in what we have put into emergency equipment in Jersey County. Wow. From power stretchers to Lucas CPR devices to vehicles. I actually drove our resource vehicle. I have a rapid response expedition that I use because I'm the supervisor, and I use it to support our crews. If they get into a crew, they need additional support. We bought it. We outfitted it. We've We've helped the hospital buy a couple of ambulances in the last few years, and we do fish fries. Our fish fries are becoming more and more
I've
popular.
heard about your
Our
fish
fries are
fries.
becoming more and more popular. But Dirk Beck is our man at the fryer. He does phenomenal work for us, helps us out quite a bit. But the community comes out in droves to support us. It's wonderful. It's wonderful. We got businesses that every time I walk in the door, they say, "Okay, what are you doing this time?" Or I have people reach out, "Hey, you haven't done a fundraiser in a while. What are your needs?" kind of thing.
That's
and they
really
drop checks,
cool.
And they drop checks and they drop checks. We're very, very blessed.
Well, I
very
said
fortunate.
it. I really have, Nathan. I said, to have what you have in Jerseyville with how many supporters that are really there.
Absolutely.
I mean, there's a lot of tight knit going on up
Absolutely
there.
right.
And just to have it, especially in your experience and your position, you're in a rural setting too, and it takes a little bit to get there, and resources are needed.
It's challenging. Jersey County is a very good sized county, and we got the Great River Road running through a big portion of it, and they keep us on our toes.
Now,
that's for sure.
with that though, just before I circle back to the Bob Page, I wanted to ask though, it seems like there's different terrains and regions of Jersey County too. Like you said, with the River Road, then you're going up into fields and a little bit of farmland. Does that affect how you guys respond too?
One of the things that we see, what's unique about rural versus city, we never know what we're going to get into.
Yeah.
And when you have a call in the city, you've got unlimited resources. Mm-hmm. It may be a chest pain patient, but a fire truck with 6 people is going to roll up with you. That doesn't always happen rural. We've got great first responders that respond with us and help us out, but there are times it is literally just the ambulance crew. Which that's what we're for. That's what we do.
Yeah.
But and we do so. We may not have thanks be to God. We may not have the shootings and stabbings and things as much as in the city, but we have lots of farm equipment injuries. We have lots of accidents, motorcycle accidents, traffic accidents, and with the 4-lane, we got a chunk of 4-lane right there in the county too. So it keeps us busy.
Well, and too, any situation, I'm sure it's if someone's in distress, no matter what the situation is, stabbing or shooting, it's getting out there and helping. And how many volunteers do you guys have? Do you guys take?
We're actually not volunteers.
Oh, really? Okay,
we're
that's what I was
service.
curious.
We're a paid service. We have an ambulance. We have 2 ambulances on 24 hours a day.
Okay, really cool.
We have an ambulance at the hospital, and we have an ambulance at the fire station that's out on Route 3 and Elsa Road.
Okay.
And they spend some time down in Grafton too. We got a substation down in Grafton as well, especially when it's busy during the summer. We try to spend as much time down there as we can. Be seen, let the public know, hey, we're here. No, I always say that we're kind of like an umbrella. If it's not raining, the umbrella's in the way. You don't want to see it. But when it's raining, you want
that,
it.
Yeah, you want that damn umbrella.
That's exactly right.
And I wanted to bring that up because, there's so many facets. Because I've seen, the fish fries, and I've seen all the great things you guys have done in the last few years with the foundation, with the ambulance services. And I've always been curious about learning more. So I figured, what better time than doing it now,
Absolutely.
So with that being said, Nathan, let's circle back to this great speaking event with Bob Page. I mean, this is really great. This is at Jerseyville High School. It's 2 days.
2 days,
And
the 20th and the 21st.
You can't beat this. I mean, I thought, because whenever I saw the flyer, I initially thought, well, maybe, the $20 is just to get, on the list, because for these types of speakers, that's what you're looking to, pay.
True.
But to have this resource where you guys are saying, just come all, give us, compensate your lunch, but then just learn and let's experience this together. Is
Exactly.
Great, man.
Exactly right. And, I've been very, very fortunate. Our administration is enormously supportive of everything we want to do educationally. Every element, every facet. What can we do to grow? What can we do to improve? What can we do? What can we offer to the community? We're expanding on our CPR classes and things like that because everybody should know it.
Yeah, you're right.
Everybody should know.
You're absolutely right.
We do AED training. We do CPR training. We do Narcan training.
That's becoming something that people need to start learning. It
absolutely is, and we try to tie that into every class we do. But
I wanted to ask you, just to circle back real quick, to the AED machine. With so many, athletes now, I think in national media, with DeMar Hamlin last December, it's one of those that I always think it's good to know, even for Park and Rec parents and coaches.
Absolutely.
Because you're never going to need to know. You're never going to need to know how to use it until you need to use it.
Exactly.
So learn
and
now.
one of the first things the Ambulance Association did was donate an AED to our Park and Rec department.
Did you?
Because we do donate to different organizations and things because they are so important. They truly make the difference between life and death.
Yeah.
They truly make and they are They're idiot proof. You cannot mess them up. They are so step-by-step explanatory to use.
Well, and that's honestly good, because for me in that situation, because I know how I am in a stressful situation, I ain't too good. Now, unless it's like, public turmoil and all that, I'm the calmest in the room.
Sure.
But if it's for life and death, like what you guys are going through, I would need something that's idiot proof.
And literally there's different times, there's different styles, there's different brands, but every one of them is consistent in that you turn it on and it tells you everything you need to know. Apply pads to patient's bare chest. Plug in pads connector next to the flashing light. And then it analyzes it. And people get nervous. What if I do the wrong thing? What if I shock somebody that shouldn't be shocked? You can't.
Okay.
You can't. When we do it, when we use our equipment, our monitors and our defibrillators, we have to interpret what we're seeing on the EKG and on the monitor and determine, yes, this patient needs to be shocked.
Okay.
And do it. Mm-hmm. With the AEDs, the machine itself does the determination. Yes, this patient needs to be shocked. No, this patient does not need to be shocked. So it will either say continue CPR, or it'll say defibrillate, or press the flashing button, whatever. It does it all itself. It cannot be messed up. That's why we want them everywhere. Yeah. We don't want you to be able to walk into any public building without seeing one. Mm-hmm. We don't want you to be able to walk into any athletic event without seeing one. And the other thing that we do in Jerseyville, or from the hospital does, for our businesses and our church organizations and our schools that have the AEDs, they are required to be inspected annually. Okay. And the hospital does it.
That's cool.
We just do it as part of our community outreach. We've got a guy that comes in, takes a day or two, sets aside. Generally, I go pick them up from wherever they are, bring them to be inspected, and take them back. It's like 10 minutes each piece of equipment. Yeah. It's just the JCH Healthcare wants to help everyone, whether it's in a medical emergency, whether it's an operation or ongoing care, whether it's community outreach, whether it's education. We want to be there. We want to help you. I'm telling you what, and just hearing you speak a little bit, but also seeing just the work that's done from the organization as a whole, the passion that you guys have for the community and the county and beyond that is just absorbent. And I think that's why you guys have such success, and that's why the community supports you guys too, because I think you're right. I think they can see it. Yeah. I think you're right. And now with that being said, I want to circle back here in a couple of minutes before we wrap up, because we got to get you out to Springfield. I got a meeting. It's never boring. No. I promise. Well, hell, I'm telling you what, I'm impressed. So with that being said, I wanted to ask about your role as an EMS coordinator and training center coordinator for people that are interested, because it takes a certain individual that to me that can do this job, because you got to have some mental fitness to this. You got to be able to see some things. I don't disagree. What's your first step, or what's that first? Interesting. We just started. There's different levels of EMT. Okay. There is an EMT basic. There used to be an EMT intermediate. I don't know that it's recognized anymore, maybe in some areas. But then there's an EMT paramedic, which is what I am. Mm-hmm. And we actually just started an EMT basic class like 3 weeks ago. Oh, wow. And so I teach it at our training center on Mondays and Thursdays. I've got 8 students in it, fantastic students, really involved, really eager. The other thing that's kind of cool, our system, each first responder agency has to belong to a system that is the go-between for the Department of Public Health. Okay. The system coordinator is responsible for their education and their licensing and their vehicle inspections and all that kind of thing. We actually have 3 ambulance services and 7 fire departments in our system that I oversee. Wow. Greenfield, Rockbridge is one department. Root House, Whitehall, Medora, Shipman, Rosedale, Fielden, fire departments, and then Calhoun and Medora ambulance, and of course our ambulance fall into our system. That was pretty damn impressive. There was no piece of paper in front of you. That was impressive, man. And see, I think it's so fascinating, because my brother's a firefighter and paramedic over in Olin, and works with various fire departments, and was up at QEM, and just to hear some of those calls, and I'm going, it's 1 o'clock in the morning, and it's you guys are up and you're working. You just never know. You just never know what you're going to get into. So if people are interested in learning more or wanting to be a part of this when this course is done and the next one starts, how can they reach out? My email is nbishop, for Nathan Bishop, nbishop@jch.org. It works. I used it yesterday. So with that being said, let's circle back. We got 3 minutes, and it's all for Bob Page, coming up July 20th through the 21st. So excited. Man, this is so cool. Yeah. Because I'm not going to lie, I should have sent you the email going, hey,
What event are we talking about? I didn't need to because I love talking about all that you guys do, so I knew I'd have fun. But when you throw this out in front of me, it's like, wow.
We're excited. We're very, very, and it was an easy sell to administration. I said, look at this, and they said, jump on it.
And now, how receptive was Mr. Page in coming down?
He was thrilled.
Really?
He said, Nathan, I would love to. I absolutely would love to. And he just gets so excited about it. He enjoys doing what he does. Mm-hmm. Therefore, he's good at what he does. Therefore, he makes the rest of us better at what we do.
You're absolutely right. And with that being said, the fee, if you guys are just tuning in for this seminar and you want to get 16 hours of CEUs, $20 for food.
Right.
I don't even consider that.
And one of the days, and everybody loves this, one of the days is... the Chick-fil-A. Sorry. Had a little moment there. One of the days is Chick-fil-A.
I have a moment every day on this show. I just stare at the camera for 20 minutes. That's even better.
See there? I do get excited.
So you got a couple of incentives there. You got Bob Page or Chick-fil-A, so pick one,
Either or.
With that being said, for more information, for people that want to register or reach out and learn more, how can they do so?
Again, reach out to nbishop@jch.org. I can hook them up. Check out our ambulance association, JCH Ambulance Association on Facebook. Mm-hmm. Just,
That's awesome.
Reach out. We'll hook you up.
By the way, should I tag the Ambulance Association or the Jersey Hospital?
Any of the above.
I tagged the hospital yesterday and went, I hope they don't get confused.
No, that's perfectly fine. We're all one big happy family.
I'm telling you, and it shows. Seriously, everything you guys do.
We're very fortunate. We're in a great area. We've got great support from the county. Great support from administration. Mm-hmm. Everything we can do to grow and expand, we're trying to do. We want to expand our education.
Without a doubt. Nathan Bishop, thank you so much for your time.
I appreciate it.
And please come back too whenever you want to come back because I loved speaking with you. I love everything you guys are doing. Do you like Vanilla Ice?
Yes.
There you go. August the 4th, we're going to kick it at the Alton Amphitheater with Vanilla Ice and I Love the 90s. Rob Bass tag team, all for one, coming down and putting on. I'm telling you, the show of shows down there.
Very cool.
All you have to do is go to riverfrontamphitheater.com. That's Alton riverfrontamphitheater.com. And you can get all the latest information because we are less than a month away for all of us turning our visors some type of sideways and having some fun.
That's awesome.
The tickets are available at metrotix.com and throughout the summer, check out the Alton Riverfront Amphitheater website, and that way you get updates on the Food Truck Festival, Jazz and Wine, Alton Expo.
Awesome.
And then we're kicking it August 4th. I hope to see you there. More ticket information, metrotix.com.